Hello, I'm Dr. Mark Daly, founder and director of the Wellness Center. If you're watching this, you most likely have migraine headaches. I have successfully treated over 4,000 neurological and musculoskeletal cases over the last 15 years. I'm going to do two things on this short video. First, I want to explain what a migraine headache is. Second, I want to offer you a gift certificate for a complete evaluation and examination. To get the gift certificate, just fill out the box to the right with your email address and your first name, and you'll be directed to a website with a printable gift certificate worth $150. Now let's talk about migraines. A migraine headache is a form of a vascular headache. Migraine headaches are caused by vasodilation or enlargement of the blood vessels that cause the release of chemicals from nerve fibers that coil around the large arteries of the brain. Enlargement of these blood vessels stretches the nerves that coil around them and cause the nerves to release chemicals. The chemicals cause inflammation, pain, and further enlargement of the artery. The increased enlargement of the arteries magnifies the pain. Now, migraine attacks commonly activate the sympathetic nervous system in the body. The sympathetic nervous system is often thought of as the part of the nervous system that controls primitive response to stress and pain, the so-called fight or flight response. And this activation causes many of the symptoms associated with migraine attacks. For example, the increased sympathetic nervous activity of the intestines cause nausea, vomiting, and diarrhea. Sympathetic activity also delays emptying of the stomach into the small intestines and thereby prevents oral medications from entering the intestines and being absorbed. The impaired absorption of these oral or medications you take by mouth is a common reason for the ineffectiveness of the medications taken to treat migraine headaches. The increased sympathetic activity also decreases the circulation of blood, and this leads to paler of the skin as well as cold hands and feet. The increased sympathetic activity also contributes to the sensitivity to light and sound, as well as blurred vision. Migraine headaches affect 28 million Americans, with females suffering more frequently, 17% more so than males. Missed work and lost productivity from migraines creates a significant public burden. Nevertheless, migraine still remains largely underdiagnosed and undertreated. Less than half of the individuals with migraines are diagnosed by their doctors. Migraine is a chronic condition with recurrent attacks. Most, but not all, migraine attacks are associated with headaches. Migraine headaches usually are described as intense throbbing or pounding pain that involves one temple. Sometimes the pain is located in the forehead, around the eye, or at the back of the head. The pain usually is unilateral or on one side of the head, although about a third of the time the pain is bilateral on both sides of the head. The unilateral headaches typically change sides from one attack to the next. In fact, it's important to note that unilateral headaches that always occurs on the same side, should alert your doctor or you to consider a secondary headache. An example would be one caused by a brain tumor. Now, a migraine headache usually is aggravated by daily activities like walking upstairs, nausea, vomiting, diarrhea, facial pallor, cold hands and cold feet, and sensitivity to light and sound commonly accompany migraine headaches. As a result of this sensitivity to light and sound, migraine sufferers usually prefer to lie down in a quiet, dark room during an attack. A typical attack lasts between 4 to 72 hours. As a matter of fact, when I was growing up, my mom suffered from migraines, and I know that she'd have to close herself off in her bedroom, take a wet washcloth, lay it on her head, and go to sleep. For approximately 24 hours after a migraine headache, the migraine sufferer will feel drained of energy and may experience a low-grade headache along with sensitivity to light and sound. Unfortunately, some sufferers may have recurrences of the headache during this period. Chiropractors believe that some migraines originate in the spine. Often, a misalignment of the vertebra, or what we call a subluxation, can irritate the nerve that travels the length of the spine to the brain. This misalignment makes a person more prone to chemical imbalances in the brain. Some researchers say that realigning the vertebra, which is what we do as chiropractors, relieves the pressure against these inflamed nerves and can in turn relieve the headache. And I know that I've had that experience in clinical practice. As a chiropractic physician, I diagnose the cause of these migraine headaches and treat it with the appropriate clinical protocols. Now please fill out the form to the right of this video, get your gift certificate as well as a few tips on beating migraine headaches. Thank you so much for watching. I wish you the very best of health.